Dr. Kelly, could you introduce yourself and
Sure.
tell us where you work?
I'm Michael Kelly with the Paso del Norte Health Foundation. I'm a senior program officer there. Our offices currently are located at the Wells Fargo Tower on the 19th floor here in El Paso.
And could you give us your general job description?
Well, I haven't read it in a number of years. But my job is to originate and plan and oversee the funding of and evaluation of major health initiatives in southern New Mexico, primarily Luna, Doña Ana, Otero counties, far west Texas, El Paso, Hudspeth counties, and Ciudad Juarez. So we work with everything from physical activity and nutrition, which is an area I'm currently working in. We work with tobacco use, alcohol, substance abuse. I used to work in that area, not doing it right now. Access to medical care, which is primarily policy approaches. We don't really work with like providing operations or surgery. And teenage pregnancy prevention. We also do leadership and capacity building, kind of bringing organizations together. We're in the middle of designing a regional strategic health plan for the Paso del Norte region. And we just launched a new health leadership program, which we're looking at taking kind of executive directors and CEOs and the like, and building their leadership capacity. So that I work in all those areas.
Okay, and out of all those areas, can you take us through maybe in a little more detail of one of those projects and what you do in that project and your role?
Yeah. Each project is in a very different phase. You know, our board of directors establishes goals or strategies or focus areas, I guess you'd kind of say. And then our program staff, which I'm one, take a goal area. For example, I work with physical activity and nutrition primarily for children and youth. And in this role, I write a strategic plan, which means you've got to be pretty good at a literature review. You need to know where to find your data sources that are credible. You need to know how to write, good technical writing, and then putting together kind of a budget as to how much something like this could cost, estimations. But it's a high-level strategic approach towards physical activity and nutrition in the region versus what I call a tactical approach, which would be more of the on the ground. How do I teach someone? Am I going to use a video or PowerPoint? Am I going to do role play or lecture? I don't get into that. I used to, but I don't anymore. Right now, we want to deal with very large strategic direction, and then our partners, our grantees at various not-for-profits, government agencies, and the like, will design tactical solutions to work with various populations. So we start off with a strategic plan. Part of that strategic plan also involves looking at evaluation. And there are very different levels of evaluation. You've got to understand this almost intuitively. So I look at not only BRFIS data or YRBS data. We do look at those. We like them. We certainly benchmark ourselves there. And off Healthy People 2020 and other benchmarks like that. But then we look at our grantees' programs and we ask ourselves, how do we know that this grantee is being successful, efficient? What does efficiency mean? I mean, you can get something done if you have enough money. The question is can you get it done with modest resources and still be effective? So we have to look at effectiveness. And sometimes that means I have to supervise evaluators who come in. So we'll contract evaluators to look at these programs. Sometimes I'll conduct the evaluation myself, which means locating valid, reliable instruments, knowing how to collect the data. Sometimes we actually put through a request to an institutional review board. But most of the time we just have to apply our own ethical standards. And it's very important that one reflect on the ethical standards of health education and research. It's not just an intellectual exercise that you do in class. This is something that I have to look at every day. In fact, just this morning, we were talking about some ethics in a particular program, and would an approach be ethical or not? And certainly when it comes to data collection, we have to look at that. So there's all this planning phase, and then when we implement, we it's like contracts, but they're grants. We grant out to our agencies. They implement the program. They're the ones actually like teaching people or advocating for policy, and then the evaluation we monitor. So, we cover the whole spectrum that you see in the 7 responsibility areas.
Okay, very good. Could you describe your educational background from undergrad to graduate years?
Yeah. Well, I entered college as a theater arts major. I enjoyed it, but I knew I didn't make a career of it, so I switched and got my bachelor's degree in biology. My Master of Education is in health education, and my PhD from Texas A&M is in health education.
Okay. And what are some of the challenges of your job?
I've kind of thought about that because you gave me the questions ahead of time, and I didn't come up with a great answer. I think, they're not unique challenges. Health problems in a community are, they're hard to solve. So, operationally, I don't have any challenges. Everything's an opportunity. So it's just, I guess, the variety of work. I suppose if I did the same thing day after day after day, it'd be easier, but it'd probably get boring.
Okay, and this kind of leads to the next question. What are the rewards of your job?
Yeah. Well, there are a lot of rewards, particularly for foundation work. As a program officer, we get to, I like it kind of like a blimp floating above the city. And you can see and you get to know, well, what's happening with that federally qualified health center? What's happening with the Department of State Health Services? What's happening with the city public health department? How is the Pan American Health Organization working? What are our various universities up to? So, we get to see a very broad view. And we also get to see the community. We're out in colonias. We're in the inner cities. We get to see people, too, living their daily lives in health education classrooms, eating lunches. So we're out in the community quite a bit. So I think the biggest reward for me is that variety of getting to know a lot of people and seeing a whole lot versus just that routine.
And in your experience, because you work with a variety, like you said, agencies and organizations, and your own agency or foundation, what's the salary range for an entry-level health education specialist and maybe a more advanced health education specialist?
Well, it's all over the board. Many of the not-for-profits start pretty low. I haven't checked lately, so I don't know, 30,000 maybe. About the lowest where they're starting, I would imagine, these days. I would hope not lower than that. A doctorally prepared health educator with years of experience, a foundation or in government work, CDC, something like that, could easily crack 100,000 a year.
So the range is pretty great.
The range is great. The range is great, and I always like to think that the degree can get you in the door. But once you're in the door, it's up to you to prove yourself. You can be the most highly educated person and fail. You're not motivated, you're not working hard, you're not creative. Or you could be someone who, fine, I got a degree, but you really just work real hard and you're effective, you get along with people. So those soft skills are so important, and move along just fine and fast. But I like to think it's kind of generalization. If you're a generalist, you can advance more, I think, than if you're a specialist. I think of the Army. When you think of, hey, specialist so-and-so, that specialist is doing something very specialized. They don't call the general a general for nothing. He's a general. You're a generalist. It's pretty high up.
Are you CHES certified?
I am right now. I keep up with the hours sometimes. I know there's a new master's certification out. I just haven't spent the time to do it. So I think it's a good certification. I think undergraduates should likely pursue it.
And do you have any recommendations for them as far as how to pass the CHES exam, or what would you advise? Study.
I mean, if you went to school and you'd actually studied and thought about your material, you'll do fine on it. If you did a bunch of group projects and had someone else do the work for you, and you know who you are, you may have some trouble.
And other than that, what is your advice to future health education specialists?
Well, I don't know if I have much advice at all. I like the general advice, stay general, work in a variety of settings, get a good practical experience. You need to be in kind of a public health WIC program at some point, or I did sanitarian work for a while, out in the field, and you need to get your hands dirty before you move to what I'm at is a kind of a more administrative type of job, high-level strategy. While you may have the ability to do that immediately, it's still a real good idea to get your hands dirty. I think it just gives you credibility in the long term.
And this is kind of a broad question, but I'm particularly interested in your opinion because you work with so many different types of groups and organizations. What do you think future challenges and directions for the health education profession are in terms specifically of training and evaluation?
Well, training of health educators. I just don't do much training. I still teach once in a while, planning, evaluation kinds of classes.
But from your end, what would you like to see the students coming out with that you are hiring or work with?
I think, the basic thing they need to come out with is ability to learn and adapt. So the idea of expertise, or the idea of, I know how to do something so well, you're going to hire me to do it. Generally, you're not hired right out of college because of your expertise. I mean, maybe after 20 years, you're hired for your expertise. But if you're able to learn, if you're able to adapt to a public institution like a government-run health department, and they have their own certain challenges with kind of, I guess you'd say, bureaucracy, which isn't a bad word, it's the way government works, or kind of the uncertainty of a consulting life. You've got to be able to adapt and learn. When I hire someone or when I give a grant, I want to make sure the person is smart enough to know when to ask for help, how to do the research, how to learn about how to do a presentation better. I'm not hiring them because they're the best already. I'm hiring them because they know how to learn, and they can kind of frame concepts in their mind, and they can think about, use higher order thinking to advance their skill sets. So I think that's probably some of the most important stuff. If there were a health education skill, it probably revolves around communication. I think, communicating in front of audiences, classrooms, communicating in writing for sure. I see a lot of very bad writing, and that's just something that's not going to set well with me. That's bad writing. That you just doubled my workload. Now I got to look at everything you do, and that's not good. So definitely polish up on the technical writing.
In terms of evaluation?
Are you talking about evaluation skills coming out of class, being able to evaluate a program?
Yeah, or even more broadly, how are programs being evaluated in this climate with where resources are becoming scarce?
Evaluation's a real tricky area, and it depends on who you're talking with. Evaluation is always a politically confined arena. And what I mean by that is you have various stakeholders. You have funders, you have program managers, you have participants, you have people who designed the program, and they're all looking at kind of the approach, the program, whether it be kind of health education delivery or educational policymakers or media campaigns or whatever it happens to be. They're all kind of coming at it from a different angle. And I think one of the greatest kind of ahas of an evaluator is to understand that audience that you're working with and you're working for, so that you can deliver the kind of report that the consumer who's paying you, your boss, wants. So, my natural tendency, of course, is to look at process. How is it being delivered? Because if you're not delivering efficiently and effectively using good communication, learning methodology, and the like, you're not going to get any output. So you might as well not spend the resources seeing if people learned or changed behavior if you're doing a bad job up front. But and then looking at proximal health outcomes, or proximal outcomes like knowledge, attitude, skills, and then behavior, and then finally health. So I mean, we can look at all that. It gets very expensive very quick to do a comprehensive evaluation. So I think really understanding what I will just say, kind of scoping your work, knowing what your charge is, and getting that on paper, spending a lot of time up front, and then designing the right evaluation for who's paying you it's just really important.
Okay, do you have anything to add that we haven't covered?
I don't think so.
And just to add, Dr. Kelly was my professor when I was an undergraduate.
Oh, that's right. Yes, Dr.
Forgot
Thompson
about
was my
that.
student years ago.
Well, thank you so much for your time, and thank you for what you do.